Welcome to SeriousTech, Engineering the Future, a podcast where we deep dive into the critical role of domain expertise in shaping successful careers in technology. In a rapidly evolving tech landscape, mastering a specific domain is what sets top engineers apart. Join us as we explore how domain tech is transforming industries with a special focus on healthcare, and hear from experts who have built cutting-edge solutions by combining technical brilliance with specialized knowledge. If you're looking to stay ahead in your tech career, this is the place to be. Today, we are joined by Chaitanya TSK, a technology professional with 12 years of experience in solving high-impact business problems. He has worked extensively in analytics and artificial intelligence across the retail, consumer packaged goods, and energy industries. He transitioned to healthcare with CitiusTech, and he now leads engineering teams to deliver market-ready digital solutions. In this episode, Chaitanya will share his insights into how an engineering-driven approach is solving healthcare challenges, key trends shaping the provider market, from digital products to evolving care models, and how modern technology and user-centric solutions are driving the future of healthcare and what that means for engineers. Welcome to the show.
Hey, hi Laurel. Good morning. Thanks for having me here today. I'm Chaitanya. I work as a manager with CitiusTech.
It's great to have you. I'm looking forward to our conversation today and hearing more of your expertise on our topic. I want to first start with your background. You have a very diverse background, as we mentioned in the intro. What was your journey into tech like, and what led you to that transition to healthcare?
Yeah, I started my journey in tech about a decade ago, and I started as a data scientist working with the retail industry. And I've spent about 8 years in the space of pure play analytics, big data analytics, working with retail, CPG, and energy industries before I made a transition to healthcare technology with CitiusTech. One of the primary motivations for me to join CitiusTech was to kind of work in a software engineering environment while doing AI. Because at that point in time, I did see that a lot of analytics and AI work was getting productized really fast, and having a software engineering mindset to developing AI was becoming very important. And secondly, I wanted to specialize in a domain so that my experiences and my further skills are developed in context of a domain, and healthcare seemed a very nice fit because of the richness of the data ecosystem and the fundamental technology challenges that healthcare technology industry brings with it. Excited me to join CitiusTech.
Plenty of industries are rapidly evolving, especially technology, and then healthcare is rapidly evolving. And it's such a great industry to be in, and especially domain to be in as an engineer. And within healthcare, another market that's rapidly growing is the provider market. And especially when looking at digital products and how they're playing a bigger role in the delivery of care. How do you see that transformation shaping the industry?
Yeah. So, of the many trends that are kind of playing out in the healthcare industry and more specifically the provider market, digital transformation is certainly something where we see a lot of ambition and a lot of drive from our customers. And this is largely because over the last few decades, there has been so much standardization brought into the space through EMRs, electronic medical records, electronic health records, being very sophisticated to capture every point of a patient's journey, that this creates a whole system of a very rich data ecosystem evolving. What that leads to is you have thousands of encounters happening on a daily basis in healthcare facilities, and data about all of these encounters are getting captured in the EMR. How can digital transformation or digital products use that data and give value back to the point of the encounter, where both the caregiver or the provider and the patient can benefit from some digital tools and some digital experiences that can make that whole encounter more meaningful. So, if the core objective of digital work and digital products in care journeys is being able to give the value back to the interaction, to the encounter, with all the data that has been captured through the EMRs and EHRs over time.
You've mentioned briefly in some of your answers here that healthcare has some unique challenges to it when we're working in this space. And in that, you're working with other healthcare providers and creating partnerships between yourself and others. Working in that space and working with others comes with its own unique challenges as well. And so what does it take in this space to build successful partnerships and really drive some real change?
Yeah, I think the whole problem breaks down into two core issues, right? One is, what are the technology challenges or opportunities that we face when we implement solutions, and what about the domain makes it challenging as well. So when it comes to the technology side of our implementations, healthcare technology is very standardized. Information exchange happens through strict protocols, and knowledge about those protocols and how information exchange needs to happen is very key to implementing solutions that will scale. And at the same time, when you look at healthcare itself, um, it is a domain where the problems are traditional. For example, to make it more real, we are currently looking at a problem where we're trying to answer to a provider who's looking at a patient from the whole history of the patient, that we might really know what part of their patient history is actually relevant for the provider to see, so that it saves the time for the provider to form a clinical picture, and also treat the patient specifically, right? So, in trying to answer that question on what is the right part of patient history that needs to be shown to the provider, you really need to know the therapeutic area really well. You need to make conclusions that make sense in a clinical context. So, being able to iteratively work with practice, use the feedback, and develop a solution that really makes sense to clinical teams also happens to be challenging. So, I would say, to summarize, on the technology front, building industry grade technology with high level of standardization needs experience, and at the same time understanding the domain, being empathetic to the context of the patient, and making sure what you inform makes sense to the provider is also part of the challenge.
And with that, I'm curious, what makes CitiusTech's work stand out then?
Yeah, CitiusTech can be a great partner for large healthcare enterprises, because most of our work is with large healthcare customers in the space. And over the last 2 decades, we have developed a lot of experience working with different problems. So when somebody works with us, we come with that interdisciplinary context within healthcare technology. And secondly, having worked in these different markets and these different industries, we are almost always well ahead in knowing what is out there in terms of technology. Like in the space of AI, we're already building our foundations in agentic architectures, quality and trust. So some of the work we do in our practice to build a kind of foundation and offerings around emerging technology trends is also to advantage for our customers, because we invest in having a head start in what is trending.
Yeah, seeing around that proverbial curve and working towards it and having solutions in place for what is ahead, because as we've been speaking about, it is rapidly evolving. There's always things changing and growing and always new projects. So why is now then a great time for engineers to make a career in health tech?
Yeah, I would think for anybody who likes working in a diverse context in terms of skills, because problems in healthcare are not a single skill for arena, so to say. So any problem requires a combination of product engineering, data analytics, cloud enablement, and understanding of the domain. So I think more and more people who enjoy working within diverse talent groups, and secondly, being just passionate about technology, because unlike most of the other industries, healthcare presents both an opportunity and challenge in the kind of data it has. It being mostly unstructured in terms of language, image, video, this kinds of information comes in, and building technology around that is a little advanced in nature. The skills required are a little advanced in nature. And again, somebody who's looking to have a very humbling experience of working in caregiving in a healthcare space, where you get to hear feedback from providers, from people who are surrounding patients, might just make it very real from a problem solving standpoint. So these are some of those reasons why CitiusTech is a differentiator for talent. And as an organization, it's very empowering for the employee. CitiusTech invests greatly in training programs to help you learn the domain, ramp up on the domain side, and at the same time have a path and a journey on your health tech career. So you will see a very rich training ecosystem and a management that is truly behind you if you want to focus on upskilling yourself and getting deeper into this area.
Yeah, it sounds like a lot of diverse projects. You can do a lot of different things. It's always rapidly growing, so that continuous learning and having the support of a great team behind you. And ultimately, in this space, engineers are creating projects and solutions that ultimately affect somebody's life and their healthcare, which is a very exciting thing too, and be able to positively impact lives around them. So that's
Absolutely.
wonderful.
Yeah,
Chaitanya.
I would generally call it an environment where there is never a dull moment.
Mhm.
It is always something or the other is keeping you occupied, keeping you thinking, keeping you talking. So it's a good space to be.
It sounds like it. Yeah, it's very exciting. And Chaitanya, it's been such a pleasure to sit down with you today and uh, talk about this and be able to see the bright future for engineers in healthcare tech. It's been a real pleasure. Thank you so much.
Hey, thanks, Laurel, for having me over and asking me those questions. Um, yeah, I'm happy to be doing this.
Thank you. Thanks for coming. The SeriousTech Engineering the Future podcast is brought to you by CitiusTech, a leader in healthcare consulting and IT services. To find out more about CitiusTech, visit CitiusTech.com. To listen to more interesting insights on healthcare technology and innovations, search and subscribe to CitiusTech's YouTube channel.